All right, Saagar, what are you looking at?
Well, last week I did a monologue on the new guidance from the American Academy of Pediatrics for childhood obesity. It recommended using weight loss drugs and surgeries on minors more aggressively and earlier. While the Academy didn't include lifestyle intervention in its recommendations, there were also so-called experts who created the guidance, who I showed here, saying that obesity was not a, quote, lifestyle disease. Whether you agree on that central premise or not is the entire question. Do you want to manipulate our environment, our food, our lifestyle to prevent obesity? Or do you want to just let big pharma companies sell us the solution? I know where I fall in that debate, but at a certain point, all of us critics do need to make peace with this fact. We have very little influence beyond the individual level on any of these decisions. They are made by multi-billion-dollar companies, massive government bureaucracies like the National Institutes of Health, the CDC, the American Academy of Pediatrics, and the Food and Drug Administration. At least one of those, though, we may have a slight chance of actually having some reform. The FDA is under massive fire right now, especially during the last 2 years, for its incompetence in its response to COVID, from rapid testing to its handling of vaccine approvals to just the blatant corruption revealed in Revolving Door with the pharma companies and taking their word for things. Well, we finally have a chance to actually make amends. Not on the drug front just yet, but something possibly even more important than drugs: food. The food that we put in our bodies and the regulations that govern that industry, subject of multi-billion-dollar lobbying efforts that shape everything that we see in our grocery stores. It all starts with the FDA, and even Branch Covidians, who would probably defend the FDA's conduct during COVID, cannot deny they have failed at the basics of their food mission. Back up for a second. The FDA oversees approximately 80% of the entire U.S. food supply. It has a few basic missions. Number one, make sure food is safe, not poisoning us. Number two, provide nutrition guidance and facts for consumers. Three, to conduct routine inspections of food safety to ensure that companies are not cutting corners and that Americans are eating what companies claim that they are. They have failed categorically at all three parts of their mission. As Helena Bada-Miller-Avich at Food Fix has noted, since 2011, despite getting more resources and a mandate from Congress to investigate foodborne illness outbreaks, some 128,000 people are hospitalized a year from foodborne illness alone, and 3,000 a year people actually die. Parents have been screaming now for years, finally heard during the baby formula crisis, how many times the agency has dropped the ball and missed deadly outbreaks in food and formula for infants on top of multiple foodborne outbreaks in 2022 alone. The nutrition side is also just insane. I'm sure many people saw these viral segments about NIH-funded Food Compass studies at Tufts University, which concludes that Lucky Charms are more nutritious than ground beef or steak. It sparked rightful outrage, in my opinion. But the question is, how do you even fix that? This is the key part. The FDA's literal mission statement is to try and promote nutrition information and evaluate claims based on food to the general public. Take the word healthy, for example. FDA has allowed the same definition of, quote, healthy to be slapped on consumer goods since 1994, when I was a 2-year-old. In that time, I think it's fair to say we've gotten a hell of a lot fatter as a country, unhealthier, and we've also learned a lot about nutrition. Yet in 2022, they have decided to propose updating the label. Just so you know, what did the previous label allow? It placed limits and guidance on several minerals and vitamins in food to be called, quote, healthy. But, and this is the biggest but, it placed no limit on the amount of added sugar in a product, and the ability to call it healthy is evaluated by the FDA. Imagine that. You could literally make sure and game the system by having some vitamins, add some fat content. You can have as much refined sugar, though, as you want and still call it healthy in the grocery store and dupe parents and consumers. Anyone want to claim with a serious face this was explicitly carved out, not explicitly carved out at the behest of the food and sugar industry? We all know the answer. I'm not going to sit here and I am going to sit here and claim we wouldn't be fat if the FDA had proper healthy guidance in stores, okay? I'm not. But it's a shining example, though, of how broken the system is. It also observes the fact that they can do something about it. Take sodium, for example. The exact same menu items in the United States actually have double the amount of sodium that they do in European counterparty foods, like McDonald's. Our FDA has effectively refused to set mandatory sodium guidance, which nutrition advocates have been saying can save tens of thousands of lives per year just through reduced hypertension. After literally 3 decades of fighting the FDA, they still have refused to set long-term guidance, as other developed nations on Earth have had in place for more than a decade. By some estimates, some 250,000 lives actually could be saved just from doing this alone. All of this bears scrutiny at this moment for a simple reason. A major fight is brewing in Washington right now after an independent review of the FDA found that it has completely failed at the food aspect of its job and should possibly be spun off into its own independent food agency. It's actually gaining steam in Washington. I want to add some fuel to that fire. Currently, the FDA is one of several agencies that actually looks at the entire U.S. food supply. The system is designed not to help or look out for you, but to be as inept as possible and make it as penetrable as possible for lobbyists at big food and agricultural companies which want to make money. Our well-being has nothing to do with this. Spinning the agency itself off will not fix everything, but it makes a single point of concentration more vulnerable to public scrutiny and to lack of incompetence. No more passing the buck. In the meantime, wake up. Healthy food label doesn't mean it's healthy. Quote, guidance from doctors is sometimes right and sometimes it's totally wrong. It's dangerous and it's driven by money. Until we take back our system, you need to look out for yourself because they sure as hell are not going to. And that's the crazy thing, you know, the healthy food.
Hey guys, ready or not, 2024 is fully upon us now, and Saagar and I have been brainstorming ways that we can really up our game for this critical election.
Yeah, we rely on our premium subs to expand our coverage, to add staff, to upgrade the studio. We just want to give you the best independent coverage of this election, which is possible. So if you can help us out, become a premium subscriber today, breakingpoints.com, or the link is down here in the description video. It really means the world to us, and if you like what we're all about, this is the best possible way to keep us 100% independent, working only for you.